Today I will be speaking about a field of psychodermatology. My name is Hakan Okur. I am the psychiatrist in Fatih Sultan Mehmet University, and in this panel I will be speaking about the psychodermatology and its place in psychiatry. Dr. Yurdum Sinan Yücel is working as a dermatologist in this field, and he will be speaking about the dermatological diseases. Ali Cemal Yılmaz will be speaking about the psychodermatology and the cosmetic problems and solutions. Last but not least, Kübra Aslan will be speaking about the psychometric tests in this field. As you know, starting from the humanity, the body and the psych interaction is being discussed, and this is defined under the psychosomaty. In 1918, psychosomatic medicine is used as a communicational model. Today, the conflicts and the psychological needs are also affected by the skin. Freud and his colleagues migrated from Europe to United States, and then the desire for psychosomatic studies increased, and the first journal was published. In 1940s, American Psychosomatic Association was founded, and the studies were institutionalized. In 1925, a Philadelphian dermatologist, Joseph Croider, said that some of the skin problems shouldn't be ignored, and he wrote some of the pioneering texts in this field. And the studies had psychoanalytic perspective. In 1956, the psychological methods of this field has been evaluated, and psychoneuroimmunology publications try to understand the relationship between the psyche and also the skin. Only a couple of psychologists continue to work in this study. In 1991, North American Association was founded. 1 year later, European Dermatology and Psychiatry Association initiated its activities in this field. Germany, France, Belgium, Japan, Germany and England, there has been some units and departments who are working in this field specifically. In Turkey, we have to work in this field as possible as we can. 10 years ago, in Şişli Eftal Research and Training Hospital, under the dermatology clinic, we have opened psychodermatology polyclinic, and we followed the patients every week. In order to increase the interest in this field, last year, together with the panelists, we founded our foundations. This is the 5th meeting that we have, and we are thinking about continuing our studies in this field. Psychosomatic medicine, after making this introduction, I would like to start to my presentation. Psychosomatology is dealing with the skin, and ectoderm, skin and mind, is affecting each other. Skin, through orifices, is collecting the information from the outer environment and sends it to the nervous system. This flow might be in both directions. In the recent times, the development in this field has led us to understand that the emotions are coming from the cortical and subcortical regions. French analyst, French Anziu, came up with Derrida concept and biopsychosocial approach was developed. Today, all of the patients who are coming to the dermatology clinic, the psychological factors are taken into consideration. For psychosomatic medicine, it is stated that some psychiatric disorders might be present itself in the skin. Up until now, 100 new types of disorders have been defined.
Tıbbi durumu etkileyen psikolojik etmenler başlığı altındaki
Effects of the psychological factors in medical condition can be seen from the slide. Each of those disorders might be a topic of another presentation. I will be speaking about them: atopic dermatitis, urticaria and angioedema, acne vulgaris, rosacea, telegondefluum, primerhibidrosis, prurigo nodularis are the dermatological disease, but they are also affected by the psychological factors. Trichotillomania, rigid dysmorphic disorder, psychogenic excoriation, and oligophagy might be placed under the obsessive-compulsive disorders. Chronic idiopathic pruritus and itches might be defined under undifferentiated somatoform disorder. Idiopathic glossodony and dysestenemic vulvodyny might be defined under the pain disorders. Parasitos delusions might be about the delusional disorders and somatic type. Psychogenic purpura might be defined as another disorder in this field. Psychogenic excoriation might be evaluated under the OCD spectrum. It presents itself with illusions. Patients accepts that illusions are formed because of the patient itself. Patients will have stress and spontaneously they will itch their skins. This patient has psychogenic excoriations, 60 years old, female patient. Starting from 20s, this patient has many problems of OCD, washing her hands frequently. Because of her OCD, she didn't receive a treatment. And she didn't enjoy her life, and she went to a psychiatric clinic. Clomipramine was initiated, and then the dosage was reduced to 25 milligrams. In a psychiatric examination, she has an obsession of cat stool. For 20 or 30 times in a day, she washed her hands for 2 minutes. Skin lesions was started 10 months ago, and after the itches, the wounds have been developed. Psychotherapy has been given to this patient. 5 milligram aripiprazole was added to the treatment, and then we increased the dosage to 150 milligram for clomiprazole. And the OCD symptoms were reduced by 50%. After our third interview, she went back to the city that she was living. The picture on the left hand side are the first picture that she came to us, and on the right hand side you see the pictures after the treatment. Body dysmorphic disorder is commonly seen in patients who got never married. These patients are perfectionists and they apply to the dermatology. Parasitosis delusions might be common with touching hallucinations. Amphetamine, cocaine, alcohol, phenazine, and after the usage of corticosteroids they might pop up. The patients will try to clean the skins and get rid of the parasites, and after those cleaning trials the parasites will be submitted to the doctors. Trichotillomania can be seen from our slide. Impulsive and compulsive features will be present. Focus type and automatic type will be present. Onychophagia has severe types. Hand infections and dental problems will be present. The disease is characteristically recurrent. After pathological behaviors, this patient will have relaxation. Dermatitis artifacts. In this place, patient will make lesions himself and they will deny that they formed the lesions. The story of the patients will be inconsistent. They will tear, lift or cut their skins in order to have lesions. Psoriasis will have negative effect on the quality of life. Psoriasis is quite resistant to the treatment. After the lithium was cut, then we see that the symptoms of the psoriasis will be gone away. 15 or 20% of the population will have urticaria and angioedema. In 70% of the patients, we don't know the underlying reason. Adrenergic urticaria might be treated quite successfully. Those diseases will affect the quality of life in the patients. Acne vulgaris will be aggravated under stress, and the patients will have subjective complaints. The bad self-image will be present in those patients' population. Chronic idiopathic pruritus. Long-term itchiness is defined as such. Mental trauma will reduce the threshold for itching. The duration of itching will be higher in certain patients. Chronic idiopathic pruritus again is another important problem. When we speak about the treatment for those patients, biopsychosocial model will be important. We should question those components. Because of the stressors, patients may not recognize what is going on in their lives, and sometimes the skin lesions which are emerging because of such stressors might be a problem. In terms of the medication selection, the right medication should be chosen. Two different psoriasis patients might come up with two different tables. One of them might have anhedonia and the other one might have high level of anxiety. Fluoxetine-like agents might be chosen, and for the other, paroxetine type of molecule might be chosen. Delusional parasitosis and such kind of psychotic problems aripiprazole and risperidone type of agents are used as first choice. In the depression and anxiety, SSRI might be used and tricyclic antidepressants might be chosen. In addition to that, anxiolytic, hypnotics and beta blockers might be used in appropriate patients. Therapy is a good treatment option for this patient group. Psychoanalytic approach was common until 1970, but today we are using CBT. The behavioral therapy and the psychoanalysis in Germany is reimbursed by the Social Security Institution. And in the psychodermatological disease, there is an infertile circle between mind and skin, and we can turn that into a positive circle. After me, my dermatologist friend will be speaking about the psychiatric aspect of the dermatological diseases.